press, follow them posteriorly. Sometimes your patients have little dimples. The Psis will be right in the immediate area. They are the most broad and prominent posterior protrusions of the ilium. And when I bisect the two, I can be on S2, right? Or at least I think I'm on S2. We went through kind of that process before, okay? To find the coccyx then, once I'm on S2, I can just follow inferiorly until I come off the edge of the sacrum and into the coccyx, okay? So that's that. Sacroiliac joint, go back to the PSISs. And I'm gonna be on my side, the side I'm on right now. Find the PSIS. You're going to do just medial and inferior. You're going to find the groove of the sacroiliac joint. This is not a joint that is very easily palpated, okay? It has a lot of broad ligaments over the top, so you're not really going to get in there and feel the joint line. But what you're going to try to do is almost like hook your fingers around medial and inferior to the PSIS to get in there. And then what you can do is you can take the person's hip and start to internally, externally rotate it. So internal rotation, external rotation. On internal rotation, you may start to feel a slight little gap in of the SI joint. It is not going to be this big, broad movement. Don't expect it. The SI joint's the most stable joint in our body. It doesn't like to move. It doesn't move much. I'm a believer in that it does move. There are those out there that feel like it doesn't. I'm a believer that it does move, but however, it does not move much. Remember, the shoulder is the most flexible joint in your body, the most mobile joint in our body. The SI joint is the most immobile. So it's not too uncommon to see lots of individuals have SI joint problems because that's a joint that doesn't move much, and lots of people have shoulder problems because that's the joint that moves too much, right? So, all right. Ischial tuberosity, inferior lateral angles of the sacrum. What you're going to do is you are going to attempt to palpate the lateral edge of the sacrum first, okay? So your fingers are trying to find just below the PSIS, you're trying to get along this lateral edge of the sacrum, and you're going to follow it down inferiorly until your fingers start to come in medially, okay? So that's where I am now, and you can see where that lateral edge of his sacrum is. And so what I'm going to do is I'll just keep following it down until I feel like my fingers right there is where my fingers look like they want to just barely go in medially. And so right there is going to be his inferior lateral angle of his sacrum. Right there. So that's his inferior lateral angle. The last one's the ischial tuberosity. The ischial tuberosity posteriorly, the person's prone. What you're going to do is you're going to locate the gluteal fold. That can be hard on over these larger shorts. What you're going to do is you're just going to press into the hamstrings a little bit. You're going to proceed medially and superiorly until you hit the bone that's there, and the only one that's going to be there, that's the ischial tuberosity. Okay, and so you can just kind of outline that. Right there on here. Okay? So those are the posterior. Okay? You can do that in prone. There's also a sideline method. So you can do the ischial tuberosity in sideline as well. Okay?